It's every surgeon's desire for their patients to have a successful outcome. Yet complications can occur during any procedure, most commonly blood loss and surgical site infection. In fact, a recent study published by the University Center of Wound Healing in Denmark concluded that despite the use of antibiotics and sterile techniques, surgical site infections are still a real risk and represent a substantial burden for both patients and healthcare services.
Some of the most common complications after surgery are blood loss, infection after surgery on the incised or tissue that's repaired, prolonged recovery times, or chronic pain.
Medical science has long known that the body has two remarkable defense mechanisms to prevent blood loss and infection during traumatic injury. The body seals wounds through the use of platelets, and white blood cells are our first line of defense against infection. Researchers have found a way to harness these components of a patient's own blood and turn them into a powerful solution that can be used during surgical procedures to minimize blood loss and prevent infection. The compound is called platelet-rich plasma, or PRP.
We take a small amount of blood from a patient, anywhere from 30 cc's to 180 cc's, depending on how much product we need. We'll put it in a centrifuge it down. The blood will actually form three layers: the red cells, the buffy coat layer, and the plasma. The buffy coat layer is what we want. Inside the buffy coat layer is a high concentration of all your platelets and your white blood cells.
The buffy coat is then mixed with thrombin and calcium chloride. Thrombin activates the platelets, and the calcium chloride will block the anticoagulant. This then forms a PRP gel. The procedure of harnessing and applying PRP is relatively new, yet it has been shown to accelerate healing, reduce inflammation, and even minimize the appearance of surgical scars. PRP has been used successfully in orthopedics, neurological, and cardiovascular surgical procedures. The technique continues to gain widespread acceptance among practitioners nationwide and around the world.
Any place where there's necessary healing that needs to happen, we'll put the platelet-rich plasma on that site and try and promote tissue regeneration.
Because the creation of PRP uses the patient's own blood, there is no risk of rejection or transfer of disease, making it a safe and effective technique to stop bleeding and reduce infection. PRP has many applications outside of the operating room, from improved treatment of non-healing wounds to more successful skin and bone grafts. Since PRP is infused with bioreactive proteins, also known as growth factors, it can also be used to aid in the recovery of sports-related injuries.
We can take tissue that your body uses normally to heal collagen that's been injured, and we can speed up that process or make the healing process even more complete by using our own body cells, and that can either be regenerative injection therapy using growth factors from platelets, or we can use stem cells that come from bone marrow, or stem cells and other matrices that come from fat. A lot of our patients are concerned when they hear stem cells that we're getting stem cells from another source. In this case, we're actually taking your own body stem cells, so the person donates the cells that we utilize, either growth factors or stem cells or other matrices such as fat, to fill in these tissue defects and repair tissue.
As the baby boomer population continues to age, the field of orthopedics is experiencing a boom of its own. Surgical treatments for arthritis and other joint diseases such as total hip and knee replacement are on the rise. These are invasive surgeries with much tissue and blood loss, making them an ideal environment for the use of PRP.
I can use the platelets in an office setting, and I can get the ligament and tendon, muscle, and arthritic joint to heal and recover without surgery. And in conjunction with surgery, you're going to facilitate the healing of the tendon, ligament, bursa, or arthritic joint. Or if you have to have surgery because you need to put something together, it's too separated away, and you have difficulty filling the defect in with an injection, then you could use it along with surgery, and you accelerate the healing dramatically.
Slow or non-healing wounds take a devastating toll on society. According to the American Diabetes Association, over 80,000 foot amputations are performed every year due to complications of non-healing wounds. Plastic surgeons and those that specialize in wound care see where platelet-rich plasma may be used to reduce that disturbing statistic.
I've had the advantage of seeing the benefits of platelet-derived growth factors in healing for patients with chronic wounds. So it's very exciting to see a new technology developing, such as platelet-rich plasma, which allows us to use the patient's own blood, their own platelet-derived growth factors, so that we can start them immediately at the time of surgery and get better wound healing.
Patients who have undergone the PRP therapy during their surgery report experiencing less post-operative pain and a remarkably quick return to their everyday activities.
I ruptured my patella tendon in the fall of 2007, so almost 2 years ago, playing hockey at the time, professional hockey player. Before I had surgery, I had 15 months of physical therapy and doing things, and the nature of my injury was just such a catastrophic one that, nothing else was kind of really helping, and after I had PRP, I've noticed a significant change just in my pain levels of doing everyday activities.
Every doctor that we went and saw during these 18 months was, we could, do this, but it's a 50-50 chance you're still going to lose your foot. The PRP, I've had 3 treatments so far. Once the bone infection was healed and gone, then the PRP took right off and healed it.
Played soccer all my life, and about 4 years ago had a injury, had a tear in my meniscus. Went in, had it surgically repaired through orthopedic surgery. Got back to playing shortly after that, but then after a couple of years, it started to deteriorate further. Since I've had the therapy, it's been a year-long process, but now I'm able to get back out playing soccer again. A couple months ago, I was able to run a 10K race for the first time.
Currently, we're using PRP for a number of applications in the operating room. Essentially, anytime we've got tendon disease or tendinopathy, where we're going in and fixing either a chronic rupture or an acute rupture, we use PRP to kind of kickstart the healing process.
It is very promising. It decreases the time to heal these wounds that are chronic in nature, many times for years in existence. And it's going to play an essential role in trying to salvage lower extremity wounds, such as what we see in podiatry.
Plastic surgeons have used autologous fat or fat transfer in order to fill areas that have deflated over the age, such as your cheekbones or malar ridges. Unfortunately, that fat doesn't stay there for a long period of time and it deflates quickly. But the addition of PRP allows for greater volume retention and for greater length of retention of those facial fat grafts.
The future of PRP is extremely exciting. Tissue regeneration, transplantation, anti-aging techniques are being developed right now. I think it'll actually become standard of care in most surgeries.
For more than 23 years, Comprehensive Care Services has been providing patient care and medical services throughout the U.S. CCS specializes in blood perfusion in many areas, from open-heart surgery to therapeutic apheresis. Our latest service is platelet-rich plasma therapy, a technique that has been shown to accelerate healing and minimize infection.
We are one of the few service providers out there, when you consider blood services, that is comprehensive. The other really, I think, important piece to this is that we measure and collect all the data on our patients. We provide this information back to our institutions, and we look really closely at evidence-based medicine.
At Comprehensive Care Services, all our perfusionists are certified by the American Board of Cardiovascular Perfusion. We take pride in knowing that our people are the best trained and the most experienced in the field. Our team approach and multidisciplinary background ensures that your hospital or facility receives the very latest in comprehensive care and state-of-the-art perfusion techniques and equipment. We offer adult and pediatric perfusion, cardiac assists, auto-transfusion, apheresis therapies, capital equipment for lease or purchase, and are proud of our latest service, platelet-rich plasma therapy, or PRP. PRP is becoming increasingly popular with surgeons and sports medicine practitioners nationwide. For over 2 decades, Comprehensive Care Services has been committed to improving patient care and surgical outcomes nationwide by bringing the highest standards in the industry to every service we provide and refining the state of healthcare one procedure at a time. For more information, log on to ccsperfusion.com or call 800-741-5985.